Hello and welcome to the Holistic Psychiatrist Podcast. I'm your host, Dr. Alice Lee, the holistic psychiatrist practicing in Lehi, Utah. Today we have a wonderful acupuncturist, Heather Wisely, joining us to talk about acupuncture. I'm really excited to have her join us. She's not only an acupuncturist that is close to where I'm located here in Utah. She's located in Draper, Utah, but also someone that I trust enough to go see for my own acupuncture treatments. And she has a lot of wisdom to share. So let me just introduce you to her so you can know a little bit about her background. So Heather got her master's in the science in Oriental medicine from Pacific College of Oriental Medicine in 2010. She received her advanced yoga teacher training certificate in 2010. She became a Reiki master in 2009 and was a certified massage therapist back in beginning in 2001. So she has been studying traditional and holistic medicine for over 2 decades. She started her career in massage therapy to heal trauma from her teenage years, and she then quickly realized that even though trauma is effective for healing the musculoskeletal system, it's limited in treating the internal, emotional, and spiritual disorders. So she moved to New York City and started studying Chinese medicine. And while in school, Heather went to China and studied in 3 different hospitals. After graduating in 2010, she traveled to India to study yoga and complete her yoga training there. In 2011, Heather met her husband and opened their wellness clinic called Neighborhood Acupuncture and Healing Arts, where she started her career practicing Chinese medicine here in Utah and also teaching yoga. And in the last 20 years, Heather has performed over 20,000 client treatments on thousands of clients. And in that time, she has treated almost every kind of pain, from physical to emotional, and often with great success. One of her favorite things about practicing Chinese medicine is working with complicated or chronic conditions and watching people regain hope that their body has the ability to heal. So I'm really excited to have Heather share with us all of her experiences. So welcome, Heather, onto our podcast.
Thank you for having me, Dr. Lee.
Anyways, it's just been really a wonderful opportunity. When I started working with you for my own acupuncture, it was just kind of for anti-aging, kind of ongoing healthcare. I knew that because of my own, busy schedule, demanding lifestyle, that kind of stuff, that I needed a holistic doctor who could be kind of like my general doctor to go to for help. So you're it. And so anyways, I wanted to start off with a little, just an introduction about you, and maybe you can tell us a little bit about yourself and how you got interested in acupuncture.
So my journey was, both a common journey for a lot of people, where in high school, I had some emotional trauma happen, and I went through a sexual assault. And from that,
Wow.
I ended up with a plethora of diagnoses and counselors and therapists. And I think I had a psychologist, a psychiatrist, a counselor, a family therapist. I don't even know, it was so much,
Right.
with literally diagnoses of anxiety, panic attacks, depression, at some point bipolar. And after getting on all of those meds, I was actually so dysfunctional, I rarely went to high school.
Oh, wow. Mm-hmm.
Yeah, it was a pretty intense time in my life, but I think ultimately a blessing in disguise. So not having the best grades in high school limited my, luckily in some ways, limited my college options, and I ended up going to massage school. And in massage school, I started really understanding that there were different ways to think about health and the human body than just Western medicine. And when I was talking to one of my teachers about my own journey, and at this point I'd weaned myself off of all of my medications. I didn't like taking them. I felt very apathetic about life.
Yeah.
So
a lot of these medications work as blocking agents, numbing agents, but they numb everything, right?
Right.
Including our ability to think.
And express joy.
Yeah.
And, you know, so many of the other like positive emotions like surprise and excitement, everything gets numbed. So anyway, I was still pretty raw in my own personal healing. I'd had a few years, but it was still very new. And when I was talking to one of my teachers, they said the most profound thing that anyone has ever said to me, which was, if you've been through trauma, it's okay to be traumatized. There's nothing wrong with you. And after going through so many diagnoses and people telling me there was a chemical imbalance in my brain and that there was something wrong with me for the way that I was feeling, which only makes everything worse, it unlifted what I can now consider an unbelievable amount of gaslighting.
Ah, okay. Yeah, you know, as you share that, it made me think about how I ended up on my own healing journey being put on Zoloft, because I do feel I was traumatized through medical school, through the residency program, just the way they kind of like throw people out into the medical field and it's sink or swim, so to speak. They don't really support medical doctors the way they should. And we're just doing a lot of the scut work. And I wanted to quit psychiatry. And that was when they put me on the medication, the antidepressant medication called Zoloft, because they felt like it was abnormal for me to feel so, I would just say, so disenchanted and ready to quit whatever it was that they threw me into, that I was ready to just kind of restart my career at the age of 30 or whatever. But there's like, no, you're not going to stop. You're going to like take medication to numb your insights. That way you can just keep on being the psychiatrist. So.
Which is maybe part of that, one of those moments that, like I said, just leads us to that path of where we are today and completely changes your entire perspective, or my entire perspective on life, right?
Yeah.
And medicine and my journey and my personal way of contributing to society. So, so anyway, I got into massage from this personal, emotional, physical trauma, and massage is okay at healing those things. I think having healing touch can unwind a lot, but it's very limited. I was also trained as a deep tissue massage, and I had the goal of working with traumatized women and children because it was a place close to my own heart, or traumatized teens, and deep tissue is the worst thing you can do. For someone who's been through emotional trauma or physical trauma. So I just didn't really have the tools that I wanted.
Can you explain why it's the worst that it can do for trauma, deep tissue?
Well, because you're prying into the body.
Okay.
So if somebody's already had an injury, whatever kind of injury that is, if they've been traumatized, first you need to establish trust.
Oh, okay.
And healing touch, and going deep and aggressive in someone who's already in a fragile state isn't necessarily healing. Yeah.
Also, I do notice that people who go through massage, especially if they're vulnerable, it releases a lot of the toxins that are held in the body, and they're not ready to kind of clear it because the rest of the organs aren't healed enough to help clear the toxins. So they can sometimes end up with pretty intense emotional reactions to the detox process.
Yeah, you need to be gentle.
Okay.
And I think that was something that was very much missing from my massage education, or not something that I gravitated towards when we were learning it. So so that led me into acupuncture school. We learned a little bit in massage school. I had an introduction into acupressure and into the basic theories of Chinese medicine. So that was enough to get me interested eventually, after a few years, to go back to school, and which was actually another way of unwinding my own trauma, because high school was such a bad experience. Going and getting my master's degree was actually a process of healing.
Yeah. Sometimes becoming healers become our healing journey, right?
And knowing that I could get like straight A's or close enough, and it was like, okay, I'm not locked into like these very, very bad grades. So it's also, I feel like that's also something. Sometimes in my clinic, I do have, young teens that are in some kind of trauma, and their parents are so worried about how bad their grades are. And I'm like, they'll be fine. I had an entire high school semester where I had 6 Fs and a D minus. I still got a Master of Science.
That's wonderful.
So,
and
anyway.
you can, that's the thing about being great healers, is that sometimes we can dig into our past and come out of it wiser from our experiences, and be able to then support other people who are feeling that all hope is lost, because we've been in places where things felt that way, that all hope is lost and there's no other path that we can take. But when we survive those incidences, then we can give hope to other people. Yeah. So I really appreciate you sharing that.
So, so I went to acupuncture school, and acupuncture has a whole host of tools for dealing with all different kinds of traumas, which is one of the things that I really love about it.
Yeah, wonderful. So it's a very long healing journey. And since then, you've been practicing for over 20 years, which is, it's a lot of experience. So today, I think I'd like to just focus on the mental health aspect, since this whole podcast is about how can we holistically support someone who's trying to restore their mental health. So from your perspective as, someone who does yoga and the acupuncture and knows about massage, tell me what your perspective is on how mental illness occurs. What are some of the underlying causes that you think generate mental illness from your perspective?
So there's the Chinese medicine perspective, and then there's my personal perspective. Personally, I think what I see in a lot of my clients that do have chronic health conditions is, as I said before, like an unbelievable amount of gaslighting from the medical community, where they're told that, this pain or dysfunction or lack of sleep or whatever they're going through, and their anxiety and depression over it are two different things, or that the anxiety, depression, or whatever are causing their physical conditions. And I think that's one of the things that we need to be really careful about always as healthcare providers, is making sure that we're not making people feel crazy for their personal experience. So for me, one of the things, and actually even Chinese medicine, when we're looking at mental disorders or emotional disorders, is the reaction appropriate to a situation? Would anyone else or almost anyone else have the same reaction? If so, then there's nothing wrong with you.
After all, emotions are there for a reason. They're there to send a message. And I think that what you're saying is that within the Western paradigm, nothing outside of being happy is normal. So if you're not happy and being kind of like positive about everything, then there must be something diagnosable about the situation?
Well, so for instance, I'm going to give a short case study on a young woman I knew who was 30 years old, top of her career, traveling around the world, and suddenly ended up with pelvic pain. And she couldn't get it diagnosed, and the pain kept growing. And she was going to every kind of doctor you can imagine. The pain was growing. There was no diagnosis. She ended up being completely incapacitated, laying in bed every day, staring at a wall. Her pain was so intense she couldn't move. And then she got labeled with anxiety and depression. And she was told that her pain was caused by anxiety and depression. However, she did not have anxiety and depression when the pain started. She had a vibrant life. And she went through 2 years of trying to treat anxiety and depression before she found out it was a parasite. It took someone listening to her entire story to realize that 6 months before the pain started, she'd been in a third world country and had not been safe with her eating practices. And it's very often that I see that particular thing. And I think even in the paradigm of Western medicine, it's my understanding that all physical causes of disease should be ruled out before diagnosing someone with purely mental emotional disease. So for me, that's kind of the first thing is, and that's really separate from Western medicine, is just looking at someone and saying, like, what have you been through in life? What is your body going through? What are your life circumstances? Are you reacting the same way anyone else would? You know, if your house burns down, you're supposed to have a panic attack. That's appropriate. You know, if you're in a car accident, you should go into fight or flight. That's appropriate. You should be in a life or death situation. If, you know, you wake up and you find out that you've had identity theft, you should get angry. So that's a major thing, and is always looking at, is the reaction appropriate to the situation? In Chinese medicine, the problem comes when either a person, the client themselves, feels uncomfortable in their own emotions. So if a person says, hey, I cry all the time, but I'm totally fine with that, or, you know, I'm anxious all the time, but I don't care, then it's not necessarily considered a disease. It's if the person considers it a disease. I'm uncomfortable with my own anxiety. I'm uncomfortable with depression or other emotions. So, or if we have the same emotional reaction regardless of the situation. I'm the person that laughs at the wedding, laughs at the funeral, laughs when somebody gets hurt, laughs, you know, like, okay, we have a problem. Or I'm the person that cries at the wedding, cries at the funeral, cries at the birthday party, you know, like, okay, something's happening here and the body is stuck. So this gets into kind of a Chinese medicine understanding of emotional disorders, which is first realizing that when we look at the word emotion, one way I've seen it broken down is E as in energy, motion as in energy in motion. And Chinese medicine describes our emotions as the direction that our energy is flowing. And it's considered to the flow of energy is said to originate from the organs rather than the brain. So this completely changes the understanding of emotions from Western medicine. Emotions are not seen as something that comes from your brain. Thoughts come from your brain. Emotions don't come from the brain in Chinese medicine, they come from the organs, which is why if you have anxiety, your heart starts racing. Anxiety comes from the heart. And it creates a particular energetic change in the body, which also often will dysregulate the breath. Every emotion comes with a particular breath, and our breath is related to our energy. So in Chinese medicine, our energy or our qi The life force comes from the fine energy of the air that we breathe, or oxygen, and it also comes from the fine nutrients of the food that we eat, or the fine energy of the food we eat, or the nutrients. So oxygen and nutrients come together, flowing within our blood, and this is what creates a healthy state. But if the energy starts to become dysregulated, then we have an emotion.
Okay.
So each emotion has a very specific direction that it moves our energy. The easiest one to identify is anger. Anger moves up. It's a powerful upward emotion, like a volcano. It starts in your gut, it moves up to your chest, it moves up to the throat. You start yelling, the face turns red, steam comes out of the ears, the little things start, the vein starts popping out. Anger is up, up, up. Depression is the opposite. This is our energy sinking down into the earth. And that's a different kind of energy than being exhausted. I often see exhaustion and depression getting used a little too closely, where people with just pure exhaustion are diagnosed with depression. And I'm like, no, you're just worn out. There's a difference between not being able to get up and just feeling tired. Anxiety is more of a frenetic energy out, like electricity. And grief or sadness is a contracting, bringing in energy. So if you think of deep grief and the noise that your body makes, that is the sound of your lungs contracting from the power of your energy. My lungs are contracting and I make that weird sound we call crying. If you think of the sound we make when we're angry, which is shouting, that's energy moving up and powerful. When we're, if people are feeling bored or stressed, we start going, something's wrong if someone makes that sound. If we're really happy, then our lungs make a really particular spasmodic sound called laughing, where our energy goes out in a happy way that's a little different than anxiety. So emotions are viewed as our energy just moving awry. It's moving up, it's moving down, it's moving out, it's contracting in. And then the different organs are all in control of that. So in Chinese medicine, we can't separate an emotional and physical disease. They will always come together. It's impossible to feel good when you're sick. Who feels good when they have the flu? Like nobody.
What about people who have cancer and they're always positive? I know some people who are like, oh, like really thoughtful of others and they're keeping up a cheery, at least a facade. I mean, I've heard of people like that. I've never met anybody in that kind of situation, but do you think it is possible for someone to be positive in spite of very ill situations?
Yes, but I think it's unbelievably hard and enlightened. I would not say it's the normal human experience. That's like people being able to do like splits in a handstand. Like, sure, some people can. I don't think I could. I mean, and I think there's also different layers of like when something is new, people don't usually have emotional reactions to like a brand new shoulder injury or something like that. But if it doesn't get healed, that starts to lead to anxiety. Why isn't my body healing? What's wrong with me? What's going on? Why can't somebody diagnose me? What's the right treatment? That eventually leads into depression. Why is my body failing me? I'm never going to get out of this. I hate my body. It hurts me all the time.
Well, I'm curious. So you shared a little bit about how Chinese medicine sees emotions and the flow of energy. What about Heather Wisely's kind of perspective? I want to hear a little bit more how your perspective might be a little bit different.
So mine really comes more in that concept we talked about on the gaslighting, where like, let's stop and look at somebody and ask, is this really somebody with anxiety and depression, or is this someone who is in an intense life situation, or is this somebody that is in an intense health situation that needs to be supported rather than diagnosed? And I think that's a lot of people. You know, I remember a client who came to me because she was on, I think, a total of 6 prescriptions for anxiety, depression, and insomnia. And it was because her husband had passed away 20 years prior.
Okay.
That was kind of what I said. Like, was there anything wrong before that happened? No, I was just fine. And 20 years later, shouldn't we be okay again? Why are we adding more and more and more medications?
Probably for the side effects of the medications.
So yeah, luckily we were able to, with acupuncture and help of her doctor, we were able to wean her down to, I think, 1 medication the last time I saw her, and she felt better than she had in a very long time. So, you know, it's, you know, that's someone who's been through an intense emotional situation and just needs someone to say, like, hey, you've lost your husband. It's okay to grieve. It's okay to be sad. It's okay to be depressed. So long as you're not going to hurt somebody or hurt yourself, like, you know, you can get to work and life is getting taken care of. These are normal emotional reactions for what you're going through. It would not be normal to be okay.
Right. Well, I know that most doctors, especially psychiatrists, are very quick to prescribe a medication to someone if they're, you know, feeling down for whatever reason. They don't even care the reason. You're feeling down, here's an antidepressant. And I've seen individuals get put on an antidepressant like an SSRI for far less reason than the loss of a spouse. They may be having a bad reaction to someone at work and may have a few sleepless nights, and pretty soon they're on a antidepressant. I had the exact situation with someone who ended up with you know, an antidepressant for just being bothered by some comments made in a grocery store. Then he tried to come off the antidepressant later on, and then had withdrawal symptoms from coming off the antidepressant. He couldn't sleep. So then he ended up in the hospital, where he was put on an antipsychotic, like one of the most powerful of antipsychotics. So by the time he came to see me, not only was he, you know, on a very powerful antipsychotic, but he was like, he wasn't able to work at all. And he was a CEO of a company before. So I think the medication sometimes, because of withdrawal symptoms, can cause illnesses that are far worse than the actual initial trauma.
Well, and what I also see is it's very rare that people are told they're in withdrawal.
Oh, okay.
I have had to, unfortunately, point that out to many people later when they told me they tried to come off of their medications, and then they had, you know, these very severe reactions, and then they're terrified. They think that's who they are.
Yeah, I know.
And they just have no idea it's withdrawal. And when I spell it out, they're shocked. And you know, so I think that's another aspect within our society that just did not really exist in ancient China. Like, we didn't have these kind of medications.
Exactly.
We didn't have the same diagnoses. Diagnoses were a little different in Chinese medicine. Like I said, it wasn't anxiety, it's heart palpitations. So they also
Well,
somaticize everything, I should say.
right. I know that from my perspective, when they come off the medication, it's withdrawal, but it's also the untreated underlying illness, plus whatever changes the body has gone through during that duration of time. And if that person has come on and off meds during that period of time, it can really mess up their biochemistry. So it's withdrawal, but it's a lot harder than withdrawal, like because of the underlying illness having evolved over that period of time.
And not knowing what you're going through.
Yeah. Mm-hmm.
You know, I feel like if you're going to quit alcohol, cigarettes, heroin, your doctors get on board, you get on board, everybody knows it's going to be a rough road.
Mm-hmm.
And when people come off of any kind of prescription medications, they're not really supported in that same way of like, hey, this is going to be potentially really intense. And that's okay. You're going to get through it. We'll do everything we can to get you through this transition.
Okay. Well, tell me about how acupuncture really makes it a little easier for people than when they try to either lower their meds or they want to heal from their sadness or anger, chronic anger, or chronic feelings of low energy or whatever.
So, well, coming off of meds is a little different. We treat that more like an addiction. And in acupuncture, there's actually several protocols that help people come off of all kinds of addictions, from pharmaceuticals to illegal drugs, even food, sugar, anything that a person can be physically dependent on.
Mm-hmm.
And that works really well. That works actually through healing the organs that can be distressed when we've had an addictive behavior, namely the heart, the liver, the kidneys. And if we can heal those organs, then the behavior of addiction calms down because the organs are strong enough. And we don't have as many cravings. But also when you start to feel better, people are less likely to crave things that are harmful.
Mm-hmm. Yeah.
You know, there's a homeopathic belief, I'm pretty sure it's homeopathic, that we crave the things that will send us into disharmony.
Why is that?
So just one, anxious people really like caffeine or forms of speed. Depressed people will crave downers. Angry people crave alcohol. And that's a generalization. That's not a hard rule or anything, but I have found that to often be true, that the asthmatic wants to smoke. That the person with anxiety loves coffee or energy drinks. You know, so it's one of those, like, this is my imbalance. And so I crave something that mimics that imbalance, but then it makes the imbalance worse. And you end up kind of in a vicious cycle. But if you can stop that and start getting someone into a healthier dynamic, then they start to crave things that make them feel better.
Okay.
And the better you get, the more healthy your cravings get. And the better you get, the more healthy your cravings get. And the more intolerant we get of things that don't make us feel good.
I wonder if the cravings are because some of these interventions that are like coffee or alcohol have short-term benefits when they take it, and then they go into withdrawal, which is the opposite, which then cause their illness to rebound, so to speak. Because alcohol for anxiety, for example, or bipolar disorder, I know that alcohol works as an anticonvulsant and it calms them down briefly. And then because it works so fast, it comes out of the body and they go into kind of a withdrawal effect from the alcohol, and their symptoms worsen. So I see that not only with alcohol, but a lot of the medications for bipolar disorder, for example, are anticonvulsants, and they can help while they're there, But of course, that's a whole different story in terms of all the withdrawal side effects that can happen if they try to get off. But so you talked about, how to help medication withdrawal by using acupuncture for addictions.
Yes.
What about other underlying causes of mental illness? What kind of things do you notice acupuncture can help with?
So in, I would say with day-to-day run-of-the-mill emotional disorders like mid-grade anxiety, depression, insomnia, acupuncture can really work quite effectively as a standalone. If someone has a more severe case that we would be alarmed for their health, then I think working in conjunction, someone like yourself that is a trained psychiatrist to help people, but then someone helping more on that physical aspect. So acupuncture, the first thing we want to do is look at if there is a physical cause for the mental condition, we want to treat that 100%.
Okay.
If you have depression because of knee pain, treat the knee pain.
Mm-hmm.
If you have anxiety because you're not sleeping, treat the insomnia. If you have postpartum anxiety, treat the postpartum woman.
Mm-hmm.
So we're
That makes
always kind
sense.
of right.
Mm-hmm.
So women's health is a completely different beast, and I'll get into that in a minute. But in terms of more of just like run of the mill, like anxiety, depression, anger, grief, sadness, we want to look at which organ emotes that particular feeling, what direction is the energy going, and then with acupuncture, we use the needles to help get the energy flowing smoothly and circulating, so it's not always just going in one direction. And that's how acupuncture helps. Herb-wise, usually we want to go directly to the organ.
Oh, okay. Well, I have a quick question, and that is, I know when I come see you, you often feel my pulse, right? Even while I'm chatting away, you're like feeling my pulse. I don't even know how you can do that. But so tell me a little bit about, how you diagnose underlying causes, like when a patient comes in and they have a general complaint of I'm feeling tired or I have insomnia, and then you're feeling their pulse or checking their tongue or whatever it is that diagnostically you've been trained to do. How would you use those kind of skill sets to kind of pinpoint what the underlying causes are and how to treat them?
So Chinese medicine has many different diagnostics. One is the patient history, you just telling me your story. One is the pulse diagnosis, tongue diagnosis, and then there's many others that I'm not trained in quite as well. There's an ear diagnosis, an abdominal diagnosis. When we're doing a pulse diagnosis, so taking a step back, if you're familiar with the idea of reflexology, where when you put the feet together, the entire body is reflected in the feet. That concept is applicable to every part of your body for your entire body. So if you know how to read it, your pinky finger can tell you the information of your whole body. Your hands can tell you the information of your whole body. Your stomach can, your tongue can, your eyes, your ears, and then the radial pulses. So Chinese acupuncture uses mostly the tongue and the pulse to look at what is happening in a person's body. And that can give us a lot of information. It's the Chinese medicine equivalent to like a CAT scan, an MRI, and blood work, which we didn't have back then. And so there's different methods of getting that kind of information. So for instance, like I said, the energy flows in the blood and the blood vessels. These things are related. And the flow of blood directly relates to the flow of your energy. The health of your blood reflects to the health of your energy. So when we're looking at the radial pulse, there are 3 different finger positions on each side, and they tell the health of what Chinese medicine calls the 6 organs and bowels.
Mm-hmm.
So there's a heart pulse, a liver pulse, a kidney, 2 kidney pulses because you have 2 kidneys, a lung pulse, and a digestive pulse. And what we kind of do is, as I'm looking at somebody's wrist, the first thing I say is, based on the anatomy of this wrist, before I even touch it, what would I expect this person's blood vessel to feel like? How big should it be? How strong should it be? These are questions that we think right away.
Mm-hmm.
Then when I feel it, I want to ask, does this feel the way that I would think?
Mm-hmm.
So if somebody's blood vessel is way too big for their wrist, or way too skinny, way too hard, or way too soft, this all tells us what is happening in the body and in the finger position of whatever organ. So if it's the heart pulse or the stomach pulse, then I can say, if the pulse feels like it's too skinny and constricted, that's what's happening in the stomach.
Mm-hmm.
Or if the heart pulse feels too strong, there's something happening in the heart. And so on like that. If all of the pulses just feel exhausted and empty, then this is a person that maybe is empty. We might look at things Western medicine might consider like anemic type of conditions. So if I'm like, oh, this should be a young, healthy person, their pulse should be like pretty strong, and then I feel it and it's like barely palpable, just a little teeny flutter. And those people know who they are. They hate going and getting their blood drawn because they know they're going to be stuck a million times before the nurse can find their blood vessel. So, like then in Chinese medicine, we look at what's the health of the blood. If the blood's not healthy, then you can't possibly be healthy.
So in the story that you shared with the woman who had pelvic pain, were you able to diagnose her parasites from your pulse evaluation?
Some acupuncturists can. I am not that good of an acupuncturist.
Okay.
And I would guess the acupuncturist she went to was not either.
Okay.
That was definitely please go to Western medicine and get all of the tests for all of the parasites.
Oh, okay.
I would not consider, some people, I consider parasites something that should be treated through Western medicine. Thank you very much. Come to acupuncture to clean up the damage after taking antiparasitic rounds of treatment.
Okay.
So she had actually gone to acupuncture, not me. It was somebody I knew that wasn't my own client, but she had gone to an acupuncturist and did not get any relief from her pain or her anxiety because acupuncture can't get rid of a parasite.
I guess acupuncture can strengthen the immune system, though.
Right. But that is a very long roundabout, not necessarily great way to treat something like a highly invasive parasite.
I see. Yeah. That's what I found too, is that I've tried over the course of my, exploration of holistic approaches, is it possible to heal just with the energy medicine piece? Is it possible just to heal with the functional medicine piece? How does it work? And I feel like the energy helps with the information and the flow of information in the body. And then the functional medicine helps with the raw materials to rebuild and rejuvenate or heal the body. And when you can have both, then it can really synergistically, affect change. But if I try to just do one or the other, sometimes there are limitations to what those two fields can do alone,
I completely agree.
Okay.
I really appreciate Western medicine or biomedicine or however whichever way you like to think of it. Modern medicine is the way I think of it. I like modern medicine for life and death situations.
Yeah, acute care.
I deeply appreciate their diagnostics.
Mm-hmm.
There's nothing acupuncture has that's quite like getting a full blood panel or an MRI or a CAT scan.
Mm-hmm.
So I think when it comes to acute care and life and death situations, Western medicine is by far the most superior medicine on earth.
Mm-hmm.
If you are having a heart attack, please go to your doctor. Don't
Not
come to
time for
me.
acupuncture.
No, not time for acupuncture.
Uh-huh.
If your
Mm-hmm.
gallbladder is about to explode, please cut it out. If a part of
Mm-hmm.
your body is trying to kill you, please go get it taken care of.
Yeah.
I don't think they're very good at chronic conditions or mid-level, what I would consider like chronic misery.
Mm-hmm. Well, that's why they're chronic, because they never get resolved using the acute care model. Yeah.
Yeah. And I think that's where alternative medicine really can come in, especially when both sides understand their weaknesses and their strengths.
Mm.
I think particularly Chinese medicine is much better at chronic pain. I don't want to set
Mm-hmm.
bones.
Mm-hmm. Mm-hmm.
I know there's acupuncturists in China that do that.
Mm-hmm.
Yeah.
Okay.
Uh,
Maybe
but
their needles are different sizes, like this big.
they're usually either the martial artist acupuncturists that are very
Okay.
used to sprains and strains and broken bones.
Okay.
But also in China, one of the things I thought was interesting when I studied in the hospital was in pre-med, students go equally through Chinese medicine and Western medicine.
Oh, okay.
And then it's later that they specialize. But everyone starts out with equal amounts. And when I was studying in the hospital, I remember just staring at this woman, this doctor, as she was like, here's your prescription for blood pressure. Here's your herbs for hair growth. This is your acupuncture for back pain. You need to go get cupping for your neck pain. This person, and she was going between all of these modalities. And honestly, it made my brain hurt. I couldn't imagine having that amount of information in my head. I feel like there's so much when it comes to Western medicine, in understanding the diagnosis, disease, treatments, prescriptions, but then you have a whole nother world in Chinese medicine. But watching it in the hospitals, just as people where this is what we use and this is what we use here. We use it here,
Mm-hmm.
acupuncture there, herbs here, prescriptions there, surgery here.
Wow, that's pretty much integrative medicine, that's for sure.
Yeah, it was one of the best things about going to China.
Mm-hmm.
Also realizing that my American education was on par for what I would have got in China. I feel like American acupuncture colleges they're just as good, I think, as going to China.
Oh, okay.
So based on what I saw from the treatments there and things, I could walk into a treatment room and go, oh, you're treating elbow pain. Oh, you're treating a common cold. Oh, you're treating digestion.
I see.
Just by seeing where the needles were placed.
I see. So that's reassuring.
Yeah.
All right. So I know one of the questions that a lot of people listening to this podcast will have is the question of, quote, how long does it take to heal? Because I get that question all the time. How long is it going to take me to get better? And so what kind of response do you give to your patients when they ask you that?
I have a really sassy answer for that I think
oh, please
almost every doctor should use, which is, well, if you depend on me for your treatment, you will have to pay me forever.
Oh, I love that.
If you treat me or any healthcare practitioner, if you're depending on somebody else to get better, you will always be in a state of dependency.
Okay.
When you view the other person as the main source of healing, you'll always be dependent.
I love that because
Um,
I actually had a very similar reaction too. I was like, just turning the question back to um, explain to them that holistic healing is a partnership. So I can do my part, and then you're going to do your part, and that's how long it's going to take.
so yeah, and it's
Uh-huh.
my answer is like, well,
Mhm.
what are you going to do at home?
Mhm.
If you view yourself as the athlete and I'm the
Mhm.
coach, I'm
Mhm.
just helping you get to your goals, but you're the one doing the work.
Oh
It won't
yeah.
take that much at all.
Mhm.
I mean, but then it's always depending on the severity of the disease. I think it's very different um, if someone is born with something like schizophrenia, bipolar, autism. If it is the way somebody is, and the what we would call in Chinese medicine your constitution.
Okay.
This is what you were given when you were born.
Mhm.
In yoga, we call it your karma. This is
Okay.
what God decided was your lot in life for whatever reason God decided that.
Okay.
Or truly a chemical imbalance in the brain. That can be lifelong. You may always need something. But if something happened to you, that's a completely different scenario. And then the severity of that will depend on maybe how long it takes to heal.
Yeah, and life usually it's a combination, right? We have our genetics, but also we have
The,
things that we
go
encounter in
through.
the environment and also experiences that add to the stress.
And then how much we're willing to put into healing.
Mm-hmm. Yeah. Yeah.
So
And so the next question though is how do we know it's working? Like when you go see an acupuncturist and then they put the needles in and then you kind of doze off for a little while and then you wake up, like how does a person know when they're making progress?
uh, it's easier if you have a specific symptom because the
Mm-hmm.
symptom goes away. So that's much easier if you're coming in with like fatigue and then the fatigue is gone. Oh, I have all my energy, or I'm starting to feel more energy, or if the anxiety decreases, if the depression decreases. Where you're coming in for the highest form of Chinese medicine, which is anti-aging, um, this is really what they call the king's medicine. That's much trickier because if you're already fairly healthy and there's nothing excessively wrong, then it's hard to go from good to better to great and to notice those improvements. But it's much easier if you feel terrible to less terrible to bad to okay and then to good.
You're funny.
um,
Yeah, that's true. King's medicine. That's so interesting that you put it that way. Um, well, I do notice when I started working with you, and I did work with another acupuncturist before you, and I felt like it was also very helpful. But working with you, just in the few sessions that I worked with you, I noticed my sleep was improving. Definitely, I think overall mood was a lot calmer. Energy was always pretty good, but just feeling a lot more even in terms of the energy state. So I think the main thing that was improving was I felt less of that frenetic energy and more of a calming energy, so that the sleep was improved. But I look forward to continuing to, work with you so that we can continue to keep my health up with whatever it is that you think that I need. But definitely, I don't expect, I think when I'm at a place where I don't have migraine headaches or problems with this or that, that whatever I'm doing is more to kind of keep from the slow erosion of health, right? Because we all have that and it's so subtle, sometimes we can't really tell that it's getting worse.
Well, and I think one of the things I've come to, and I'm obviously a little older than I look if I've been doing this for 20 years, but I think one of the falsehoods in alternative medicine is that if we just have good diet and lifestyle, then we'll be perfect forever. And our body should perform like we're 20 forever. And I remember when I started my yoga journey, seeing some of these advanced yogis like in their 80s doing these incredible yoga poses and just thinking, oh, forever, I'll just keep getting better and better and better. And in my yoga practice, that's not true. I am not as good today at 40 as I was at 20, and I've practiced a lot more. And the truth of being a human being is our body is designed to break down. We are designed, we get sick and we get injured, and these things happen. And healthy diet and lifestyle help us recover more. They help us stay better longer. But in the end of the day, we're still going to get older. But I think if you think of anti-aging, like taking care of a classic car, then we can wrap our mind around it. And it's like, well, treat your body the same way. If you put more time into maintaining your house than your body, then your body will break down faster than your house.
It's interesting because I think the Western American lifestyle is more about taking care of our possessions more than we take care of our own selves, because we're so busy. And those possessions, quote possessions, could mean our family too, like our children, our husband, our friends, and whatever they might be. But I think that it takes additional wisdom to then turn inward and invest time and attention on our own individual health, because we think that if we could have the wonderful house, the wonderful car, everything would be great. I mean, that's the I guess the illusion, the facade of wellness is all of those possessions, right?
Right. Where the Chinese medicine perspective is always going to be, what's the health of all of your organs? That's where the richness in life comes. If your heart's good, liver's good, your spleen, pancreas, and kidneys are good, life's good. You'll be happy, you'll be healthy, your body will repair to the best of its ability, and the emotions will be stabilized, and it doesn't really matter what the house is like or the car is like. So that comes into such a big part of, treating that overall emotional wellness is, let's make sure the body is functioning. If your digestive system isn't working, you're not going to feel good. And then you're going to have an emotional reaction to digestive pain. Or heart palpitations. So that is, I'm going to sidetrack a little bit on women's health, because I think physically and emotionally women are different than men, and we've been treated the same in Western medicine, which is a really big problem. And one of the first things that that Chinese medicine recognizes is fundamentally different about women than men is that we bleed all the time on purpose. And men never bleed on purpose. It's always a trauma or an injury. So this makes our physical health exceptionally different. Women are in this constant state of losing blood and therefore losing vitamins, minerals, iron, and all of the nutrients that come in the blood. And in Chinese medicine, blood is more, it's seen more vitally than in Western medicine. It's considered to hold your life, your memories, and your spirit. Is all flowing in the blood, which is why if we lose too much, we have big problems. So this is a really important part in treating women, also emotionally, because if you're walking around chronically anemic.
Mm-hmm.
In Chinese medicine, they call it blood deficiency, and it's a bigger diagnosis and more vague than anemia, because it could be that you don't have enough oxygen in your blood, you don't have enough iron in your blood, you don't have enough spirit in your blood, you don't have enough water in your blood, you don't have enough something.
Mm-hmm.
And when people have lost blood, particularly in large quantities like postpartum
Mm-hmm.
or with really heavy periods, you won't have enough blood, and therefore that creates a distress within the heart in Chinese medicine, because it's the heart's job to detect the health of the blood and then to let your body know through palpitating.
Interesting.
So if there's a bad
Mm-hmm.
something in the blood, if you
Mm-hmm.
have not enough or too
Mm-hmm.
much cholesterol, blood pressure, blood
Mm-hmm.
sugar, too much anything, the heart will tell you by, especially when life is quiet. And it's very often for women that at night, once we go to
Mm-hmm.
bed, that we start having anxiety, because that's your heart trying to communicate that there's something wrong on the blood level.
Interesting. I remember I had a patient who had 10 children,
Oh, geez.
and yeah, she had a lot of children. And then after each, her postpartum got worse and worse. And I remember that one of the things that tested well for her was iron, that she
Mm-hmm.
needed iron, among other minerals and vitamins and things like that. But her diagnosis when she first came in was bipolar disorder. And when she, took her supplements properly, she did really well. But it really kind of underscores what you're saying, is that childbirth, blood loss, the more you have those experiences, the more depleted you can end up being. And in her situation, she probably lost a lot of blood and just didn't even realize it.
I consider, so I like to think of our energy like money, because that makes
Mm-hmm.
sense to me.
Mm-hmm.
The more you have, the more you can do,
Mm-hmm.
right? And I think of every child the energetic equivalent of taking out a mortgage.
Oh, okay.
And some people are born with enough energy or money that they can take out 3 or 4 mortgages. They
Mm-hmm.
might be able to take out 10 mortgages, but that is
Mm-hmm.
a rare individual
Mm-hmm.
that will be born with enough life
Mm-hmm.
and energy that they can handle that kind of debt without suffering.
I see. Do you think that they can make up that depletion with the nutritional supplements, or is it
Uh,
not replaceable in full?
it's never totally replaceable, but you can recover to a point that you're
Mm-hmm.
not necessarily noticing.
Uh-huh.
Um, it also in Chinese medicine gets into largely into the way that we treat our body on our periods and in our postpartum care, which is
Mm-hmm.
basically to do everything you can to decrease blood loss, especially if you're bleeding heavily. And
Mm-hmm.
everything in American culture increases blood loss,
Like what?
like exercising on your period,
Oh, okay.
like dieting postpartum.
Okay. Interesting.
Um,
Because there was just a recent patient who I helped with hypertension, and she also had severe PMS, a lot of pain, but she also had a very long history of losing a lot of blood during her period. So I noticed that when I gave her some glandular supports for the ovaries and other kinds of supports, that she noticed her periods being lighter and shorter, which is very interesting.
and probably within a few months, I would bet her mood started improving because she's not running in a constant deficit.
Yeah, I think she came to me mostly for physical issues, which I was really surprised that she wanted me to work with her, because my specialty, of course, is psychiatry and mood and everything. But she really wanted to look at it from a holistic perspective. And it turned out to be a very, very growth promoting experience for me, as I use the same approaches in terms of testing and things like that to try to see what we can do to help her get better. But she did work very hard on her own health too. She was one of those patients that, for example, would come back after a session and say, oh, you know, I discovered that when I ate too much meat, my blood pressure would go up. So I'm cutting out a lot of meat in my diet and those kind of things. Whereas, you know, it's not as common for patients to really come back with any kind of insights for their health, you know, or willing to change their diet for that matter.
I think also one of the things I've noticed with that type of a client that has body awareness is they often get called hypochondriacs. And I think that's another thing that, you know, people that are aware of the signals of their body tend to get, you know, because most people are not. It's almost body shamed for being aware.
Yeah, that's true.
So I think that's another thing in just being aware of like modern issues that are a little bit different in our society is like being aware of what makes your body feel good and feel bad. It doesn't mean that you're a hypochondriac.
I feel like doctors are not really open to learning things from their patients. And they would prefer to have fewer feedback about their symptoms and stuff like that. But I remember about 2 weeks after my symptoms, you know, like I felt pretty much better on the Zoloft. I was much less anxious. And I thought, well, I feel better. I can just stop it. It was like 25 milligrams of Zoloft. It was a half of a starting dose. So I stopped it after about 2 weeks. Like it only took a week to get better. And then I waited for 2 weeks for that state. And just like an aspirin, I don't want to be on something forever. So I stopped it. And when I stopped it, this was back in 2000 and maybe, well, no, not in 2000 because it was 1992 or 1993 when this happened to me. But when I stopped it, I had brain zaps. Like my inside of my brain, I could sense it was going bzz, bzz, like occasionally, like shorting, like the electrical wiring was shorting. And I shared that with the psychiatrist who had prescribed it. And all he said was, well, that's not a good, I don't think that's a good symptom. So you need to go back on the Zoloft, right? But I've never had going on in my brain before the Zoloft. But I would imagine that, you know, he was much older than me. He was further along in his treatment. I would imagine that he must have heard that kind of problem before. It shouldn't have been his first time that a patient came to see, told him, oh, when I stop my SSRI, I get this zapping sensation in my brain, and be able to then relate it to the withdrawal, you know, from the Zoloft. Like if you ignore patients over and over again, you never learn. But if you listen to them, then after a while you can see a pattern, and then you can start to know, oh, that's a withdrawal problem from that medication. And since he started practicing probably at least 5 or 10 years before I ever did, he had 5 or 10 years to connect the dots, right? But he knew nothing. So
I think one of the hardest things for anyone who goes into a situation with the intention of helping another person is admitting that they caused harm. Or admitting side effects.
Or admitting that they don't know. In medical school, that's the biggest faux pas, is if you say you don't know. So
yeah. And I think, I don't think that does anyone practicing medicine any favors, or any of our clients. I think it's exceptionally hard to say, I don't know, I made a mistake, my treatment might have hurt you. I know the first few times in my practice that I got that feedback, because it can happen with acupuncture, that acupuncture can hit a nerve and cause nerve irritation. I felt like I got punched in the gut the first time somebody came and told me that had happened. And it took a lot of personal growth later to be able to come back and say, I'm sorry, that is a side effect of acupuncture. It doesn't usually happen, but it can, and I'm sorry.
Mhm, mhm. Yeah, I think that the only way we can grow is hitting those walls and being able to admit that you've hit a wall. Like if I've never acknowledged that I hit a wall with either functional or energy medicine, I would be where I was back in 2002, 2003, when I started just with the EFT technique that I learned about and one supplement that I knew about. So everything else, beyond that was because I needed to learn more, or I knew that I had to reach out for more information. So, well, I really appreciate all of the information that you shared today. And I want to give you an opportunity towards the end of our podcast to kind of share any advice that you want to share for those who want to explore acupuncture to help them heal from mental illness. Any advice for those who would want to hear your last parting words of wisdom?
I think there are two things to take into consideration. One is making sure that you find a fully trained acupuncturist, so someone with a master's degree or a doctorate in Chinese medicine, to help. Certified acupuncturists are not trained in this type of treatment, and dry needling definitely is not. People that have that are not trained in this type of treatment. So you very specifically need to look for a licensed acupuncturist.
Okay.
I think the next most important thing is finding a practitioner that you like and trust and get results. Because often what I'll see is people go to an acupuncturist that they just don't get along with. A lot of acupuncturists come out of the martial arts training and they're really, really good, often at treating physical injury, but maybe not the best acupuncturist for anxiety, depression, or any other kind of emotional disorder. So I think that's a really important thing, is making sure that you get along with someone, because you may have a long-term relationship. But then not only that, making sure that you're getting results. I tell my clients, if we're doing acupuncture, I expect to have, if not by the first treatment, by the third treatment, the beginnings of improvement. Acupuncture doesn't always work on the first or second treatment. Sometimes it can take 3 or 4, even rarely 5 sessions before someone will feel effect. But after 5 sessions, if someone feels nothing, they're probably getting nothing.
Okay.
And I would say that for any kind of treatment at all.
Okay.
If you've taken vitamins for a month and you don't notice a difference, they're probably not making a difference. If you've been doing a particular therapy, for a month or 5 or 6 times, depending on frequency, and you're not noticing a difference, it's probably not helping. So then change the plan. So the other thing to keep in mind is many acupuncturists are also trained in herbalism. So unfortunately, and I'm sure this is hard to imagine, not everybody loves needles. And so that can be a major stopping point for many people, is they don't want acupuncture. And what I tell my clients is, you don't have to have acupuncture. We can do herbs. We can do energy medicine. Me particularly, I can work people through different yoga sequences that can help. You need someone trained in yoga therapy for that, not just yoga, but yoga therapy. So there are a lot of different ways you can go about treating emotional disorders. And so not just thinking, because I don't like acupuncture, that you're done, or one session didn't work. But then also not continuing things that are not working or that create anxiety or stress. And
Yeah,
I
I
think
agree.
I think that's an important thing, is if you're coming in for anxiety and acupuncture creates anxiety, it's probably not the best. So those, I think, are important things to just keep into consideration, is finding someone you get along with, that you trust, the treatments are working within a reasonable amount of time, and that you're feeling better. And that should really be the key, is that you feel better. If you're not feeling better, especially with something like an emotional, mental disorder to begin with, then you're not getting better. The entire experience is subjective.
I love that. Those are really wise words, and I really appreciate all of that advice. I will just say that I wanted to mention this, but I forgot to mention this, that when I have acupressure sessions, either with you or with the first acupuncturist I worked with, it was really amazing to me that I could feel my body's energy kind of like humming or being stimulated or flowing or whatever. It tingles throughout the body. And I thought that was a pretty kind of cool experience. It doesn't happen all the time, but I feel like sometimes if you ever, for those people who are listening, they can try it and see if they can actually feel the acupuncture creating a real kind of amazing experience of tingling energy throughout the body. So anyways, I want to thank you for sharing your wisdom and your time and all of the wonderful material that you were able to share. And for those people who have been listening to this podcast, I really want to appreciate everybody who's been listening and gaining the insights that Heather has to share with us. And for those of you who liked what you heard, please subscribe to this weekly podcast for more amazing information, and please give a positive rating to help spread the message. Please subscribe to my website, holisticspsychiatrist.com, for wonderful stories and insights from my holistic practice, and where you'll find links to all my social media platforms. Once again, I want to thank Heather for being here and sharing her wisdom, and I want to wish you all a wonderful week, and come back soon for more stories and more podcasts. Thanks a lot, and take care. Bye-bye.